So Dr. Akshitha Anand she does this by staying up to date with the latest research and technological updates. She ensures that your treatments and consultations are performed at the highest quality always. So we are waiting for our doctor, Dr. Akshitha Anand, to join us because today we are going to talk about a very important thing, which is about acne management. So today we'll talk about acne management. And as I told you, acne is whether we are a teenager or an adult. It's not that if you didn't have acne when you were a teenager, you're not going to have it any point of time. You can. Even nowadays, with whatever changes are there, acne are so common in adults. So adult acne is the new thing that people are dealing with. So teenager acne, adolescence acne was one, and now this is, adult acne. Another thing is that those who have oily skin or they are more prone, of course, to acne. So I'm so glad to see you, Dr. Akshitha Anand is here with us, and uh, a very warm welcome to you, Dr. Anand.
Thank you. Thank you so much.
Yeah, so doctor, today we are going to talk about acne management, something which is related with almost all of us. I'm sure there's no one who can say I never ever had acne. So acne is that common and it is so chronic. And I know, just like me, there are so many people out there who have, gone through that phase. So first of all, what is acne? What all types of acne are there, doctor?
So acne is basically a condition which involves a sebaceous gland, and as we know, sebaceous gland is all over our body. Wherever we see those hair follicles, it is attached to a sebaceous gland, and disease of that or some disorder related to that can cause acne. So acne is a very common condition. As you said, someone has had acne once in a lifetime, maybe it a teenage acne or a hormonal acne.
Right. So acne is this problem that almost all of us, everybody will have it at one point of time. Now, what are the major causes of acne, doctor?
So first and the more most possible cause is hormonal. As we everyone knows that teenage period you get acne, so that's because of the hormonal fluctuations. That's one major cause. The second is a very common cause in females, that is PCOD, polycystic ovarian syndrome. This the main symptom which a patient presents is with acne, and then other hormonal acne, hormones such as thyroid disorders can lead to acne. Then basic unhygienic conditions, or I would say if you're infecting your face repeatedly and there's a lot of oil production, it will lead to some sort of a comedonal acne. Then your dandruff can cause acne. If a person has dandruff, they can cause the forehead acne. And if you're applying so many comedogenic products over your face, like face oils, coconut oil on the face, it can lead to acne. Then acne can be side effect of many medications, such as the most abused one, betanoate, over-the-counter medications that can lead to acne. So all of them, it's multifactorial basically. So you actually have to see and judge what's the cause in a particular patient.
Right. So, n number of things can cause acne, could be responsible for acne. Thus, it becomes very important that we go to a correct doctor or right expert, which is a qualified dermatologist, so that it can get diagnosed and then they can decide the line of treatment. Many times we see doctor various patterns, like many times on our butterfly area we see acne, many times along the jawline or on our forehead, etc., etc. But do these patterns they symbolizes something? They tell us something?
Yes, it does. So, as some people, you must have come across some people who have got acne over the forehead, like recurrent acne on the forehead. So that happens mostly in those patients who have maybe have dandruff, or they apply oil too much and keep it overnight. So that can cause actually forehead acne or a fungal acne in case of dandruff. And if a person which is also known as adult acne, if you have seen people having jawline along the jawline there is acne, then most probable cause is hormonal acne or PCOD related. And the teenage acne mostly happens around the cheek area. So yeah, you get to know a lot just by seeing like what is the location of that particular acne.
Mhm. What are are the various types of acne, doctor? Because we have seen small spots, blackheads, whiteheads, then very bumpy, pus acne. So, what are the various types of acne?
As you rightly said, blackheads and whiteheads, this is also a type of acne known as comedonal acne. So, blackhead is like an open comedone. Whitehead is closed comedone where the skin is intact, so it looks like a whitehead. So that is also acne. One acne is a papule kind of pinkish bump over your face. If you see, that's a papular acne, and sometimes it's pus filled and it becomes painful. So there's a pus formation inside. So it's a pustule formation. And in severe cases, that pus can form a nodule. Like sometimes a person can feel the acne inside the skin, like there's something inside the skin. So that is a nodular acne. So there are different grades of acne according to the severity.
Mhm. Uh, because it's summertime, we all are sweating a lot. We all are facing n number of skin conditions. But then, does sweat also leads to acne? Because especially, during COVID, after COVID, even now, many a times we wear those masks, and we have faced so much acne issues with those masks. So, does accumulation of sweat also causes acne, doctor?
Not exactly, I wouldn't say, because sweating is a different mechanism. Sweating per se will never cause acne. But definitely, if some person has acne, so their oil secretion or the sebum secretion would increase. So there's a difference between sweat over your face and oil or sebum over your face. So a person cannot actually say कि ज़्यादा sweat आएगा तो ज़्यादा acne होगा. It's not like that. But definitely in summer months, because of the excessive, especially after the workout, if person sweats a lot, it's not the sweat which is causing acne over the face or back. It's basically the dust or the germs because you're touching every equipment and then you're wiping off your face. So that can aggravate acne.
हम्म। अच्छा, एक और बात आपने कही थी बीच में डॉक्टर कि कई बार हम लोग सर में तेल लगाते हैं. दिस इज सच अ वेरी कॉमन ट्रेंड इन आवर फैमिलीज इन आवर सोसाइटी टू अप्लाई ऑयल ऑन आवर स्कैल्प एंड लीव इट फॉर से
So
आवर्स एंड मेनी टाइम्स आपने भी कहा कि उसकी वजह से भी या डैंड्रफ की वजह से भी एक्ने होता है. वी वुड लाइक यू टू फोकस अ बिट ऑन दैट बिकॉज what happens, we don't know whether it works or not for our hair or our scalp, but we just follow this tradition blindly. So, how helpful it is and how harmful it can be.
so oil does only there's only one purpose of oil to provide conditioning effect. It can be used as a conditioner. And condition, as everyone knows, is only required on the length of your hair. It can only provide moisture to your hair strands. So there is no way it will help you if you'll apply it over your scalp. That massaging can be relaxing, but it's not doing any good to your scalp. Though, and keeping it overnight is again clogging all those pores. So that should be highly discouraged, I would say. The other thing is, if you ask about dandruff, if someone is dandruff prone, oiling will definitely increase that. So that is there. And if a person has dandruff, so chances of fungus, so dandruff is also a fungal infection, like in the layman's language. So that
Uh-huh.
increases in fungal acne. If that will increase up to your forehead, there will be small, small bumps if you see over the forehead. The forehead is covered. Sometimes a person will say it's not visible, but I can feel it. So that is some sort of fungal acne.
Okay, right. So oiling and keeping the oil on our scalp for long, long time is just not a good idea. So, and because we are talking about acne, acne as well, especially on the forehead area. Now, Doctor, you also mentioned it somewhere where you were explaining the causes. What I'm trying to talk about is because in our society, home remedies are very common. We have so many influencers these days on various social media platforms, and they all have so much to say about your skin and how to take care of the skin. And not all of them are qualified dermat. Hardly there are any qualified dermat who works as an influencer as well. Now the thing is that they have so many tips, home remedies, even we are habitual of so many home remedies. Now, do these home remedies work on these acne?
So, the biggest home remedy which should never be done to an acne is putting a toothpaste there. So that's a big no-no.
That's very common. Wow.
That's very common, and that's going to just make it more worse because it can actually cause a burn there and cause irritant contact dermatitis. So that's a big no-no. That should not be done. If a person has oily skin and mild blackhead and whitehead, then there is just one single home remedy you can say which can actually help you is putting a multani mitti. That might give you some relief. But that is also for those acne which have oily skin and not that sort of an inflammation or papules are not there. Then that can help you. Apart from it, putting aloe vera, putting nimbu and all that, that will just it's
People go
gonna
ahead and put
get
garlic and ginger, God knows, almost
no,
everything
nothing,
on their
nothing.
face.
That's not meant to apply anywhere over your body. You just have to consume that. That's it.
Right. Eating helps. Applying on your skin doesn't.
Yeah, it
So
will not.
eat.
It
That
will
is
not.
more important. Yeah. And doctor, one more thing, apart from the home remedies, the next thing that comes to our mind when we have acne is to go and rush to a chemist shop and get any over-the-counter medication, any topical application. And you also mentioned that this is something which can really harm us because the topical creams can contain, things that is not good for our skin unless and until it is given in a prescribed way. So, how harmful can those topical creams be for our
So,
skin?
uh, so in our OPD, we get these patients a lot. If you'll see and you'll know that they've applied something. So whenever you will ask, you just take two names. Betnovate लगाया है, Clobazam लगाया है, and it's like yes. Because these are steroids and they might give you that instant relief. Oh, my skin is getting very much better, but the moment you will leave it after maybe a week also, it will have those side effects. There will be a flare of acne. You might have a hair growth over your face. You might have those melasma patches or pigmentation all over your face. So it's a big no-no. Please don't go to a qualified MD dermatologist and medical stores से दवाइयाँ नहीं लेना है because skin is also an organ. So treat it like one and you should actually go to a qualified person to get proper treatment for a particular time period. You can't be applying the same medication again and again also. It can harm your skin. Even like as you rightly said, there are a lot of influencers saying there's a very common this thing happening. A particular cream, it's there. It's a very potent retinoid which cannot be applied over any kind of skin, and people are just applying it randomly over the face, and they're promoting it like इसको लगाओगे दाने चले जाएंगे and all that. But they don't know how to apply, how much to apply, for how long they can apply because it's a X category drug. You can't actually just keep on applying it. But people follow trends, they'll apply, they'll ruin their faces, and then they'll come to us. So, even the acne medication should be treated like a prescription medication and cannot be used by anyone and everyone accordingly. So,
बिल्कुल, जैसे अगर कोई और दिक्कत हुई, मान लीजिए हमें बहुत ज्यादा पेट में दर्द है, बहुत ज्यादा सीने में जलन हो
that,
रही है, दर्द हो रहा है,
that,
then we'll go to an expert and we won't
that.
start popping up anything and everything.
And
So,
no one on Instagram will make videos on that. Like, पेट में दर्द है तो इसको खा लो. So they will not do that, right?
राइट, तो इसीलिए स्किन को भी हमें इतना लाइटली नहीं लेना चाहिए क्योंकि स्किन हमारी बॉडी का सबसे बड़ा ऑर्गन है, इट्स इन अ वे रिफ्लेक्ट्स व्हाट इज गोइंग ऑन इनसाइड आवर बॉडी.
And
यस
all
डॉक्टर.
these topical medication also have systemic absorption. So you should know what percentage to start, to how to upgrade that, for how much time you should put that. So nowadays there are 18-year-old children only who are applying tretinoin 0.5% tazarotene they're applying without any prescription. It's India, so you'll get everything without prescription also. So it's I think a really bad market we are getting in now.
बिल्कुल, तो इसीलिए डोंट फॉल प्रे टू दिस मार्केट ट्रैप. ये पूरा एक गिमिक है, इसमें नहीं पड़ना है और यही करना है कि अगर एक्ने है, कोई भी स्किन कंडीशन है, सबसे पहले एक डॉक्टर को दिखाना है. बिकॉज व्हाट हैपेंस, एक और बहुत ट्रेंड है कि दोस्त को हुआ, उसने जो ट्रीटमेंट किया मैंने भी वो कर लिया, घर में किसी और को हुआ, उसने जो ट्रीटमेंट किया मैंने भी वो कर लिया. बट देन वी नीड टू अंडरस्टैंड, जो हम शुरू में बात कर रहे थे, दैट देयर आर एन नंबर ऑफ कॉजेस. हो सकता है मुझे जिस वजह से एक्ने हुआ है, मेरे दोस्त को किसी और वजह से हुआ है, तो मैं वो ट्रीटमेंट करके अपना कंडीशन को और खराब ही करूंगी. ये समझना बहुत जरूरी है कि डायग्नोसिस बहुत जरूरी है और ये एक डॉक्टर ही कर सकते हैं.
exactly. And every skin is different. So every requirement of a dosage or the percentage or the concentration of medication would be different for everyone. So there is no actually one size fits all phenomena in skin. So that has to be understood, I think. And the worst part is acne, if supposedly it's a teenage acne, it will come, it will go up in like 3, 4 years itself also. The problem is the scarring it will leave behind because those scars, those pigmentation will never go 100%. So person should know that if you are not dealing with that superficial acne, you will lead to pigmentation and scarring, which will never be going 100% with any medication. Only treatment, lasers, and microneedling that can improve the effect up till 70 to 80%. That's it. It will never go 100%. So people don't understand this that they are ruining their skin texture forever.
Absolutely. And I know those who have gone through this phase, and almost all of us has gone through this phase, and we do understand that treating acne is one thing, and treating the marks and the scars is so more challenging. So of course, yeah, we need to be very careful about how we deal with our acne and the pigment ratios or scars, etc. Post acne. Now, doctor, when a person comes to you with acne or whatever kind of acne, do you recommend some tests to find out the cause, or how do you approach?
So tests are sometimes required if I'm suspecting there is some hormonal issues. It will be there won't be just one symptom. If you take history of that patient, you'll get to know that they have multiple things going on in their body. Like you'll relate many symptoms together, and if required, we'll go ahead with some blood tests. And for normal acne, teenage acne, mostly you don't need a blood test. But sometimes we need those blood tests to prescribe some medications and to see what's the hormonal profile. And if a person is very stubborn to treatment, then we might need some blood tests. But it's not for everyone. I won't say that.
And how do you decide the line of treatment, and what are the treatment options available, doctor?
So it depends again on the grading of acne, how's the severity of your acne, and what is the type of your acne. So the topical treatment will always like be a part of your treatment regimen because if there is something over your face, you have to actually apply a ointment and get rid of it. But sometimes it's quite severe and there's a lot of inflammation. So in that case, we have to give oral medication because oral medications is required in those cases in a particular dose for a short period of time. It is required, and sometimes then you taper down those medications and you maintain the person on a particular you can say treatment line accordingly. Topical is required for everyone. Skincare regimen according to the skin type is also very important for maintenance, which includes your basic face wash, moisturizer, and sunscreen. Then you have to avoid things like oiling and like things I told you, which can trigger the acne. And then comes your oral medications, if and when required.
And procedures are there for post acne scars, marks, etc. Right?
The procedures are there for acne also, for active acne also, the pigmentation left behind and the scars. So in active acne mostly and the most effective treatment is basically chemical peels. So chemical peels is a beautiful treatment because it's done something superficially. So you are not having any systemic, you can say side effects of it. And it's acting locally on the lesion. So it gives you beautiful results. And the next thing is IPL lasers help a lot with that inflammation. Then, if you have pigmentation, again, chemical peels will help you, lasers will help you. If you have those scars, those pitted scars, जो गड्ढा गड्ढा बन जाता है बाद में, then you need those lasers and micro needling devices to get rid of them. But all of these need sessions. It cannot be done in like single sitting.
Because we are talking about scars and marks. A very common thing that we normally do is to pick our acne.
Yeah.
How bad it can be.
So I would say picking your acne can be very satisfying to get rid of that pain and that pimple, but it will give
Right.
you a bad scar there, bad pigmentation there, and you leave behind a big crater on your face. So never do that. That should be highly discouraged again.
Right. So there was a question by one of our viewers, Subir, and Subir was asking that how can I keep my hands away from my face in case I have acne? And I can understand you, no, because it's like it's just not
Yeah.
controllable, to touch your acne. How we can do that? How important it is.
So these days, there's a very nice thing which has come up, which is a pimple patch, if you've heard of. So pimple patch will not actually make your acne go overnight. This
Hmm.
will not happen. इस तरीके से market करते हैं. But it's a very good thing to actually cover it up so that you don't infect it further. So I think everyone should own a pimple patch, not for the purpose of treating acne, but for the purpose of keeping your hands away from the acne and keep it covered from the dust and everything. So pimple patch is actually a good option in that case.
That way, a good option, right? And doctor, you also mentioned about following a good, healthy skincare routine. But as all of us are so busy in our lives and we hardly have any time, but the thing is, the reality is that we own like 50 bottles of creams for us, but then we don't know what to do with them because there is so much of endorsement, marketing, etc. So, what are the basics that we need to have, that we need to go for, and especially for those who have acne prone skin?
So uh, it's not you don't have to buy everything you see on market. Firstly, is that a simple basic skincare routine can do you more good than applying 10 actives on your face. So basic cleanser specifically for oily skin and acne prone skin, an exfoliating cleanser or the foaming cleanser is required because they can actually get rid of all the unclog the pores and get rid of all the sebum from your face. That is required twice a day. A lightweight oil-free moisturizer which is non-comedogenic. It should be mentioned on the bottle. That is required again twice a day. Then sunscreen is a must because it will prevent that pigmentation which is left behind, and it will prevent the damage of your skin also, which happens with time. So sun damage will be reduced. Sunscreen again, a mattifying sunscreen which is non-comedogenic is recommended for oily skin, and you have to apply it every day whether you are indoors or outdoors. It doesn't matter. So this would be the
But
basic
even
thing. Yeah.
right.
And if you have acne, then you have to go with prescription based medications for that time period if you have acne.
Hmm. This is spoke about sunscreen, the importance of sunscreen, but the fact remains that still 60%, 70% of our population is not using sunscreen as a regular routine thing. Now, my question, especially with those who have, acne prone skin, they are so annoyed with sunscreens and they'll have so many complaints. I don't like the patchy, effect on my face. I don't like the dull effect. I start sweating a lot, or I always have so many acne. I don't want to layer them up with, sunscreens. So they are so complaints, so many excuses for not using sunscreen on a regular basis. How would you like to address these
So
topics?
Indian market is improving very nicely in case of sunscreen. We have like sunscreen for every skin type now. And you can choose your preference. If you like lightweight texture, gel-like texture, or you like the matte texture, you can. Now it's just an excuse of not using a sunscreen because in Indian market now there are many kinds of sunscreen. Or if you have oily skin, especially in summers, matte will be looking better because it will not give you that greasy look. It will not be heavy for your skin type. But if someone does not like that silicone matte texture, then there are many lightweight, gel-based sunscreen as well. But a person has to apply that because you will prevent further pigmentation, you will prevent further collagen damage, which can lead to your acne scarring. And so sunscreen would be one thing which has to be in your skincare routine.
Okay, so sunscreen is that important, no matter whether you are going out under the
Yeah.
sun or not, but use sunscreen on a regular basis. Now, Doctor, how important role diet plays in acne management?
Because nowadays our lifestyle has taken a toll of like since last I would say a decade, and we are seeing a lot of patients having that hormonal acne and a lot of females having problem of PCOD. It was not the similar case like 10 years back maybe, but now the incidence is increased because of the insulin resistance they have because of the sedentary lifestyle. So in that case, there is something known as insulin resistance which has taken place, and that is increased by a factor known as IGF-1. So this has to be cut down. So this can be cut down by stopping your dairy. So dairy intake should be minimized or actually stopped, but jitna ho paye, it should be avoided. And the next is sugar intake, because again, sugar is doing the same thing. It's increasing the IGF-1 in your bloodstream, which will hence increase your insulin resistance, leading to acne. So definitely, whole milk should be avoided, and equally bad is the soy milk, so that should be avoided. Then cheese, butters, and all of these should be avoided. Dahi is still fine to be. You can have dahi. That's a good thing. Then diet में again all the sugar, chocolate, mithai, everything should be avoided. That can lead to your acne flares. Then one is very common, the whey protein. It can actually lead to acne. So whey protein should be substituted by some plant-based protein.
Right.
That is it.
So these are the things that we need to avoid. And what are the things that we can actually include in our diet to have a good skin or to manage acne?
So water, lots of fluids in your diet, fruits, vitamins, minerals. It will be then you should keep yourself hydrated. Minimum 3 liters of water in the summer should be needed. Then you can have those like lean proteins and seeds, which are pumpkin seeds, and these seeds. These are very good for your skin overall. So this should be included.
Right. There are so many viewers who are asking so many questions. They have so many questions for acne, and Meenal is one of them. What role does genetics play in acne?
Oh, okay. So genetic is indirectly related. I wouldn't say it's like if your mother never had acne, you will not have. It's not like that because it's multifactorial thing. Environment also plays a lot of role. Your personal health plays a lot of role here. But yes, somewhat similarity a genetic can bring. If your parents have a dry skin type, you might end up with a dry skin type. But again, there is no relief that you will never have acne. Again, it's a lifestyle plus your genetic composition plus your environmental factors. So it's multifactorial. You can't blame your genetics for acne. I would say that.
Right. We have Pooja with us. The question is it safe to use makeup if I have acne?
Yes, actually, makeup is a very, I think everyone loves makeup. So we can't say, you should avoid makeup. But definitely, the makeup can actually not aggravate your acne. It's only the applicators which can. So avoid using the brushes and the sponges. Rather use your washed hands or maybe disposable applicators. So that can aggravate acne. And never sleep like putting makeup because that can clog your pores. So double cleanse whenever you use makeup. That can help you prevent further acne. Then use powder product or sheer coverage products, which will not clog your pores. Don't use heavy cream products. That can clog your pores. So you have to choose your makeup accordingly. Now these days we have makeup labeled as non-comedogenic. So if you'll go ahead with those, so that will not, actually aggravate your acne.
Right. Satyam is here. Can acne occur on other parts of the body other than the face?
Yeah, it can definitely can. A lot of people have acne with the entire back and chest and upper shoulders, so it's truncal acne. Some people have acne on the butts, known as butt acne. So that these are the most common places where a person gets acne. So mostly people who are going to gym and wear that dry fit clothing with that sweating and excessive friction between the t-shirt and the skin that can cause acne, and whey protein can further aggravate it. So back acne can be caused because of that. Butt acne again, friction is a major cause. Actually, it's more of a folliculitis or the infection of the hair follicle there. And the friction, like a person is sitting a lot and is sweating a lot, and there is an infection there. That friction can increase the folliculitis problem and cause that buttock acne. Similarly, the case of your back acne, that can
Right.
happen.
Right. What is the role of lifestyle, doctor? How important is lifestyle, a good lifestyle in managing acne?
It plays a major role, as we discussed abhi pehle, that insulin resistance actually increases your hormonal acne. And insulin resistance happens if a person is obese or a person has PCOD. or a person is not very obese but is very sedentary, is not like having any activity, these can increase the insulin resistance in your body, which can further lead to acne. PCOD is nowadays a major concern, and PCOD itself is a lifestyle disease. You know, there is no medication for PCOD. You have to work on your diet and your exercise first to correct it. So similarly goes with the hormonal acne as well. So lifestyle, definitely regular exercise, regular intake of water, avoid sugar. These things you need to check.
Fair enough. Doctor, we have seen, because acne are so common and we go and seek help from the doctor and we get the treatment. But then there is reoccurrence as well of acne. So why this reoccurrence, why it is chronic and why it keeps on happening?
Yeah.
Yes,
Hello.
doctor. Hello.
Yeah, I
Did
missed
you
your.
you missed my question due to the network issue. So, doctor, I wanted to ask you that acne is something which we keeps on getting even after the treatment. If I have taken the treatment completely, there are chances that I'll get it back. So this recurrence is there. Why?
One thing is your skin type. If you have acne prone skin, you have those triggers which will be there. Like some people have that premenstrual flare. So that's going to be there. But that should not leave a mark. That should healthily go. And the chances of it decreases if you're on maintenance. And maintenance includes like your face washes and cleansers, your moisturizer, your sunscreen, according to your skin type and the weather at that point of time. So that has to be there. It's not like you have to be on constant medication, but the basic skincare routine should be there to prevent it further.
Mhm. Previously, we used to see more cases of acne in teenagers or adolescent, kids. Now we see acne in adults. Adult acne is so common these days. What is the reason behind and how to deal with it, doctor?
Lifestyle is the major thing I would say, because as I told you, the chances and the occurrence of PCOD and hormonal acne has increased a lot in past few years. Reason being sedentary lifestyle, more availability of junk food and the sweets. I would say that is there, and this and less exercise and maybe taking care of the health. It has now led to more causes of adult acne.
Right. We
And
have
also,
Puja with us.
I would say, because now people are experimenting with their skincare.
Hmm.
पहले या तो नहीं करते थे या डॉक्टर से लेते थे. Now it's like जो market में आ रहा है, they're applying over their face. So it's not like everything will suit everyone.
Market is flooded with products, skincare products, and then there are influencers who are endorsing online. We are getting to see so many advertisements. So of course, yeah, that is there, and we need to resist ourselves from that. We have Pooja with us, and her question is: are there specific ingredients I should look for in acne fighting products?
Okay, so I would like to answer this question as what you should check and not buy it if you are thinking for a acne. It should not contain any oil like avocado oil, almond oil. It should be free of oil. That is one thing. There should not be some butters in there. That should be avoided. Butters is not actually harmful or comedogenic always, but not at least in this weather. So it should not have that. It should be labeled non-comedogenic. If it's not labeled, don't buy it. So that is one thing you should check. The other thing, again, vitamin C doesn't suit everyone. And these days, vitamin C, you see like it's in every product, every face wash, every moisturizer, you have vitamin C. It doesn't suit everyone. So वो भी नहीं लेना चाहिए. Again, niacinamide is actually good for acne, but again, it's a very light molecule. It will not do wonders. Now there are people who are saying मैं 2 महीने से नाइसिमाइड लगा रही हूँ, मेरा acne नहीं जा रहा. तो ऐसा नहीं होगा कि पे चला जाएगा, but it's not bad for acne prone skin. So you can go ahead with niacinamide. That you can do. Hyaluronic acid you can use. Again, I would say avoid oil, putting like oil and butter. That should be avoided.
Right. बिल्कुल. और ऐसे भी अगर एक्ने है प्रॉब्लम है तो एक डॉक्टर को दिखाना बहुत जरूरी है before
Because
we
it's
end up
not a
worsening
disease.
the
It's
condition or
actually
something.
it's a
Yes, doctor.
disorder. So you can't actually, treat it on your own. It's a disorder. You need to correct it.
Right. डॉक्टर अभी पहले बात की थी कि कितना ऑब्सेशन होता है ना कि हाथों से बार बार हम एक्ने को टच करें, और आपने बताया कि किस तरह से एक्ने पैच उसमें हमारी मदद कर सकते हैं उसे रेजिस्ट करने में। ऐसे ही और कौन कौन सी गलतियां हैं जो आमतौर पे हम करते हैं जिसकी वजह से एक्ने और ज्यादा होते हैं, और क्या नहीं करना चाहिए, क्या करना चाहिए उस पर तो हमने बहुत बात की, क्या नहीं करना चाहिए?
तो टूथपेस्ट नहीं लगाना चाहिए। Then the other thing I've recently come across, people put haldi and oil over their acne. So that should not be done. Aloe vera gel from your garden directly, you should not place it on your face. You should not pick your acne. You should not like get any facials or cleansing done at parlors if you have active acne. Don't get it done. Then you should avoid steaming your face if you have that inflammatory acne. People say we steam it ताकि pore खुल जाए, but वो already inflammation है. That heat will actually increase that. So stop steaming your face. So these are few things you should avoid.
Because you mentioned parlors, and we have so many quacks, parlors, saloons, etc., where they claim that they have, they go ahead with peelings and everything, and acne, treatments as well. So, how important it is to go to the right person to get the procedures done?
So procedure is a medical procedure. We're using a medical grade percentage in chemical peel. So a person getting it from random places actually is responsible for their own skin. Like you can't actually say, because if they're not going to a qualified person to use that kind of a percentage of your face, like in our clinics also we do it. Like we don't allow anyone to do it. We personally do that procedure. उसमें लगाना तो पी लिए, but we have to monitor that, right? So we do it ourselves. So that it's that important to go to a qualified person so we can judge like what is the percentage, what are the side effects, possible side effects, what is the time of that there should be. So we have to see that thing. It's sad on patient's part to go to random places and getting these things over your face, because after all it's your face. You have to take care of yourself. Post and pre-care of chemical peel is also very important. It plays a lot of role in the upcoming results. So that is also necessary. And again, it's a medicated procedure. It's not a home procedure. I won't say that. Also, the brand of peel is also very important. So you should know what peel you are actually putting over your face. And patient has full right to ask us, like, what are you putting? What percentage are you using? So that is actually required.
Right. Now, doctor, before we sum up the whole session, any take-home message for our viewers?
Again, consider acne as a disease. Don't treat it yourself. You'll further worsen it, and don't deal with it for your life also कि वो अपने आप चला जाएगा. It has lot of sequelae left behind, like scarring and everything. If you see acne, consult a dermatologist and take a proper medicated guidance for a particular period of time so that you are acne and acne scar free for your upcoming years. So you should work on your diet also. You should work on your exercise part, lifestyle also. That would be.
राइट, सिर्फ हमारी अपीयरेंस से ही नहीं जुड़ा हुआ है, अपीयरेंस का मामला तो है ही, लेकिन साथ ही साथ हो सकता है कुछ अंडरलाइन मेडिकल कंडीशन है, हार्मोनल इम्बैलेंस है, बहुत दूसरी चीजें हो सकती हैं, तो इसलिए बहुत जरूरी है कि सही डायग्नोसिस हो। उसके लिए बहुत जरूरी है कि हम डॉक्टर के पास जाए। सेल्फ मेडिकेशन एक्चुअली हमारी कंडीशन को बहुत खराब कर सकता है। Thank you so very much, Dr. Akshitha Anand. It was wonderful talking to you. Thank you for making this session very informative and very interesting. Thank you.
Thank you.